Hey, and welcome. Today, we're going to demystify a pretty hot topic in healthcare, functional medicine. If you've ever felt like you're just stuck, treating symptoms over and over without ever really figuring out what's wrong, well, this is for you. Let's get into it. All right, so here's our roadmap. We're going to start with the big question that really drives this whole field, that search for a why. Then we'll define what functional medicine actually is, compare it to the conventional medicine you're probably used to, and even get a feel for what a visit is like. We'll also get real about whether it's right for you. And finally, figure out where it fits in the grand scheme of things. So let me ask you this. Are you tired of just treating symptoms? Feeling like you're just putting a Band-Aid on a problem? Maybe bouncing between different doctors, but never really getting to the bottom of it? It's that exact feeling, that frustration, that leads a lot of people to start looking for another way.
And that brings us right to our first stop, the search for a why. This is all about digging deeper than the surface-level symptoms.
Okay, picture this. You've got some chronic issue. Maybe it's fatigue, maybe it's digestive upset, or just this brain fog you can't shake. You go to the doctor, they run the usual tests, and then you get the call. Everything looks normal. It is so incredibly frustrating to hear that when you know something is off. And it's right there, in that gap between feeling sick and having normal tests, that functional medicine really starts to ask some different questions.
So, what is this different approach really? Let's break down what functional medicine is all about.
At its core, functional medicine is all about you, the patient. Now that phrase, systems biology-based, sounds a little intimidating, but all it really means is that it sees your body as one big, connected system, not just a bunch of separate parts. The main idea, the absolute key, is to find and fix the root cause of a problem, not just cover up the symptoms.
This slide really says it all. It shows the fundamental shift in thinking. Conventional medicine is fantastic at asking, what disease do you have? So it can match a diagnosis to a specific drug or surgery. Functional medicine takes a step back and asks, okay, but why do you have this problem in the first place? It's a small change in words, but it leads to a completely different investigation into your health.
Here is the perfect way to visualize this, the leaky roof analogy. So, imagine you find water on your living room floor. That's your symptom. Now, the conventional fix might be to just keep mopping up the water, right? Maybe the mop is a medication that gets rid of the symptom for a while. But functional medicine asks, hey, wait a second, where's this water actually coming from? The goal isn't just to mop forever. It's to find the hole in the roof and patch it up so the problem stops for good.
So as you can see, this difference in questioning leads to two very different ways of approaching health. Let's put them side by side. Okay, let's walk through this. When we talk about focus, conventional medicine is generally focused on disease. It's reactive. It's amazing when you have an emergency, like a broken arm. Functional medicine, on the other hand, is proactive. It focuses on the root cause to create health and prevent things from getting worse. And the treatments reflect that. You've got meds and surgery on one side, and diet, lifestyle, and supplements on the other. And finally, the relationship is different. It shifts from being totally doctor-led to being a real partnership where you are an active part of your own health team.
And this is exactly why so many people turn to functional medicine for these kinds of chronic, long-term issues. Things like digestive problems, autoimmune conditions, or hormone imbalances. These things are rarely caused by just one thing. They're complex, with roots in our diet, our environment, our stress, all those leaky roofs that this approach is designed to find.
Okay, so that's the theory. But what does this actually look and feel like in the real world? What can you expect when you walk in the door?
The very first thing you'll notice is the time. A typical first appointment can last 60 to 90 minutes. I mean, that's a huge difference from the usual 15-minute checkup, right? And that time is so important because it allows the practitioner to really listen to your whole story. I mean, your whole story, sometimes from birth till now, to start connecting the dots.
And that first visit is just the beginning of the journey. It starts with that super deep dive into your health history. Based on that, you might do some advanced testing that looks at things standard blood work might miss, like your gut health, specific hormone levels, or nutrient deficiencies. All of that info is then used to build a plan that is 100% personalized for you. And it's not a one-and-done deal. There's ongoing support to tweak the plan as you go.
So what's actually in this personalized plan? Well, it's a lot more than just a prescription pad. It's a full roadmap that really focuses on lifestyle. We're talking about the food you eat, how you manage stress, how you move your body, and the quality of your sleep. These are the big pillars that really build the foundation for your health.
Now, of course, it's really important to have a balanced view. Functional medicine is not some magic cure-all, and there are definitely some important things you need to consider, including some valid criticisms.
One of the biggest questions people have is about credentials. The term functional medicine practitioner isn't protected or regulated like, say, cardiologist, so it's really important to know who you're dealing with.
And this is why you absolutely have to do your homework. A lot of practitioners are licensed medical doctors, MDs or DOs, who've done extra training in this field. But the term is also used by other health professionals like chiropractors or nutritionists, and their training and what they're legally allowed to do can be very, very different. So you just have to check their credentials.
And that brings us to a few red flags you should always keep an eye out for. You should be really careful if anyone promises a cure, especially for a complex chronic illness. A good practitioner will be totally upfront about costs and their methods. Also, be wary if there's a huge push to sell you their own brand of supplements, or if they prescribe a massive list of them without clear testing or a good reason why.
And let's be real about the practical side of things. This approach can get expensive. Those long consultations and specialized tests often aren't covered by insurance. It's also true that while many of its ideas are based in science, some specific treatments and tests are still considered experimental and don't have the same level of scientific evidence that conventional treatments do.
So, with all of that on the table, what's the best way to think about functional medicine's place in the world of health?
I want to come back to this quote because it just sums it all up so perfectly. It's about asking a different set of questions. And sometimes that new perspective is exactly what's needed, especially when you feel like you've hit a wall with other approaches.
And this is probably the most important thing to remember. Functional medicine is not a replacement for conventional medicine. Conventional care is absolutely life-saving and essential, especially for emergencies. The best way to think about functional medicine is as another tool in the toolbox. It's a different tool for a different kind of problem, and often using both approaches together is what gets the best results.
So, we'll end with a question for you to think about. Now that you understand these different approaches, you have more power to be an active driver of your own health journey. So what does your path look like? What questions, what tools, and what kind of partnerships are going to help you build the healthiest life you can?